I'd like to introduce Dr. Michael C. Irving, PhD, and he's a professor and a sculptor and a psychiatrist and a marathon trainer, among a multitude of other things that have what he's experienced in life and how it has affected him in areas like pain and suffering, and some of the research that he's doing in that area as well. So Michael, welcome.
Well, thank you very much, Jillian. It's my pleasure to be here. Yes, we're going to be talking about marathon running today, and we were talking about how it influences our business and our achievements.
Yeah, and remember, I had mentioned to everybody that you had survived and recovered from heart attack and stroke.
Yeah. Okay. So I just passed 66, and and when I was 65, 64, 65, I had some medical tests that were done, and I had what's called a VO2. That's how much oxygen you take in and metabolize and send out. It's one of the best tests to determine what your physiology is. And so my VO2 was, they stopped the tests because I was going beyond the limit of what was acceptable at the guidelines for the clinic. So they stopped it at 46.4. They guessed that it was probably 50, which put me at the physiology of a 30-year-old athlete. And I was going into 65. So I decided that with that degree of fitness, I might as well work at doing a few marathons rather than one marathon to celebrate turning 65. And as I began to do my marathons in August, I ended up running 5 marathons in 12 weeks to celebrate 65. And part of what we were talking about today was about pain and emotions. And there's a saying that 90% of training for a marathon is physical and 10% is mental. And marathon day is 90% mental and 10% physical. Well, I can assure you there's a lot of physical and a lot of physical pain in a marathon day after 32, 36 kilometers of running, particularly as a 65-year-old. You're pushing the physical boundaries, but those physical boundaries are managed mentally at that point, and it's your mind that gets you through that. You were asking me about my heart attack and my stroke and how that affected my marathon work. And earlier somebody was asking about this whole area of spirit and this other dimension to who we are, and how does that, what is that? And I'm not sure that I know how it comes about or what's underneath it, but I've certainly touched on it a number of times in my life. So on a Thursday evening, I woke up and there was someone in our house, and they were about 6 feet from where I was sleeping, and they got closer, and I was quite concerned about who would be breaking into our home in the middle of the night, who would be present in our home. And they were so vivid that I actually reached my hand out to this person, and they began to speak. And they said, "You're going to have a heart attack or diabetes." And their inference was that it was going to happen very soon, and that there were things that I needed to do that I was not doing, and that I knew what they were, and I was just too lazy or too undisciplined, and so 36 hours later, I'm watching Edmonton lose the Stanley Cup to South Carolina, and on my way to the hospital, with a heart attack. So what is that spirit? You know, what was that? My dream? Was that a presence? Was that my kind of knowing and showing myself? And the reality is that I'm not sure.
I'll explain that to you later.
Well, so at that point, I had trouble walking upstairs. I had trouble walking around the block, and to run down to the corner store and back would have put me very much out of breath. I lost about 100 pounds. I became vegetarian. I used a lot of mind-body tools that I had learned in overcoming post-traumatic stress, and in helping other people in psychology, in psychotherapy, with overcoming trauma. And I used those mind-body tools, visualization, guided imagery, to, in a sense, help to reverse the heart disease and cope with the heart disease. And went from what was a VO2 at the time of my heart attack, a VO2 of 26, which put me at 56 years old as the age of a 65-year-old, even though I was 56. And then when I was 9 years later, when I reached 65, I had the VO2 of a 30-year-old. So I did
How did that happen?
And it happened by listening to the heart and living from the heart. And it happened by a change of view. At first I thought my VO2 in 9 months went from 26 to 36. So that was a pretty substantial improvement in a 9-month
How are you
time.
guys doing? Anybody for juices or water? Oh, I'm so sorry. Sorry.
So that was a very substantial improvement in a short period of time, which I at that point had attributed to how I was eating. I attributed to how I was exercising, the kinds of medicines that I was taking. I really looked at that point in time of heart disease as a physical problem that you dealt with physically. You dealt with it through your nutrition and your exercise and your supplements and that. And I did see that my heart attack it helped me to turn things around in my life. It helped me to get off the couch and get active. It helped me to be closer to my family. The finality of life made me look at some of those issues. But then 18 months after I had the heart attack and I was getting better and I was theoretically very fit, I ended up having a stroke. And Doppler tests and various things were done, and it ended up that I was about 99% blocked in one of the arteries going to the brain. Fortunately, the arteries cross over, and I was probably working with half a brain and a little bit more, because he's still getting some blood from the other side, from the artery on the other side of the neck. When I was getting the carotid artery surgery to clear out the artery, fortunately the carotid artery is one of the things that they can clean out with surgery. I heard this surgeon say to the intern that was helping him, "This is what new stenosis looks like." And so in my meeting 10 days after the surgery, and I said to him, "I heard you say when you do carotid artery surgery, they give you anesthesia in this area, analgesia in this area, but keep you awake because they have to know if a clot breaks loose and you get another stroke, they have to know it so they can do some clot busting interventions." So I was awake during this surgery and got to hear this. And in some ways I'm glad I did get to hear it, because when I said to him, you said new stenosis. Did you mean the last couple of months or the last couple of years, or what do you mean by new? And then, no, it's very new stuff. And I said to him, the last 3 months have been the most stressful time of my business life. And he said, I can't stress how much you have to get your stress under control. So that put me on a different path in terms of heart health, because heart and strokes are put together because they're really part of the same system. And I began to look at things like mindfulness meditation and stress, and the mindfulness meditation sort of opened more the door to this spiritual connection, and I began to look at another dimension of heart disease, and then I went from a VO2 of 36 to a VO2 of 46, and I had was really doing quite well in heart health. And the shift was that I was looking more after what we refer to as heart. And that really I gained a greater understanding of that with another cardiac event. So here I've had this heart attack, I've had the stroke, and then 3 years after my heart attack, I'm having the same sensations. I'm about ready to go into a heart attack again because I knew what the symptoms were. I'm on an ambulance immediately to the hospital, and they're cranking me full of blood thinners, and I get open heart surgery. And resiliency is believing that things are going to get better, you're going to get through this. Understanding that there's an opportunity, there's a gift, there's a lesson in an adversity, and positive thinking. And I'm going into my heart surgery with a little bit of a real discouragement about being so successful at reversing heart disease, I thought, and so successful at learning all of these things, and here I'm in a cardiac crisis again. My son came to me the night before the surgery, and he says, we know that you want to do a Sundance. My son and I are both Aboriginal. We're Cherokee and Choctaw. And a Sundance is a very arduous ceremony for 4 days that fasting and drumming and carving some stakes that you actually put between your chest and tie to a rope. And all of that arduous activity is to help you to have a vision experience. In a sense, touch on what we were speaking about before we started. There's some other world that has messages for us, that has learning for us. And I don't know, I don't fully understand what that is, but I know that I've experienced it. So he brings some Aboriginal medicines and some ceremonial objects, and we do ceremony because he said, if you do your Sundance on the prairies and you have a heart attack, you're going to be too far away from a hospital to make it, and we're going to lose you. He said, there's nothing that's going to happen in what's going to happen in the cardiac theater tomorrow morning is going to be a lot worse than anything that could happen in the Sundance. And if your place to have the Sundance is in the cardiac theater. So we do ceremony that night in the morning, and when I go into the cardiac theater, which was I was just so in awe of the technology that's there. They freeze your body. In a sense, they stop your heart. You could be viewed as being clinically dead because they've got to work on the heart. And they slow down or stop a lot of your biological systems. And when they restart it, there may be something that doesn't restart. And so that all of the interventions for what might come or what may not come have to be prepared for and ready for. So the cardiac theater, like the number of gadgets on the wall and on the floor and around the room, was just, I was in awe. And because I'm a machine, as a sculptor, I'm a machine person. I like building things, and I like whistles and lights and all of those toys. So I really admired like in a heartfelt way, that people were very passionate about some field that they were in to build these things and to provide them for me or whoever was coming. That isn't just something that mechanically happened. It was something that the people were coming from their heart to build that place, and they were providing, and it was a gift to me that day. And when I was really appreciating that and awe of it, and I think awe is a heartfelt experience, the nurse looks at my medicine bundle and says, "What's that?" And I say, "I'm Cherokee and Choctaw, and that's my medicine bundle." And she says, "That doesn't belong there," because it was on my luggage, which they were about to take away. And she picks it up and she puts it under the table that I'm going to get the surgery on. And it's like, this is what's meant to be. This is what should happen. And I felt like I was being treated like more than just a patient, or more than just a specimen, or more than just an object. I was really being treated in a heartfelt way. And in comes the surgeon, and he's got this hat that's the most colorful hat that you can imagine. And I'm feeling like, this guy is living from his heart. This guy, and everything was falling in. Like, it's almost like in Aboriginal, we wear regalia, because that's part of that aesthetic part of ceremony. Is some of that's what connects us with spirit, and his hat was regalia. And then he turns on, he asks for some music, and somebody turns on the classical music, and I'm really in the right place. I'm being taken care of with my heart. And then when I went under with the anesthesia, there was the countdown, and things went dark. And then when I was sawn open, and I think it's because of the ceremony that my son did with me and the intention of what that was for, there was part of my consciousness that was awake, that was alert to the surgery and wasn't frightened by it. And when the doctors, there were these clamps that was holding my chest open, and I was aware my chest is open. In a sense, I'm open-hearted. And when the doctor's hand touched my heart, there was a blackness that had been there it was like all time was no time. It was like I was aware that this heart, that at one time it was black and now it was gray. And when the doctor touched the heart, this gray, which was had been previously black, but felt like because it was all time, was a moment in time. It's like what was the wounds, the heart, the broken-heartedness of being tortured earlier in life lifted and rose and went away. And it was like, that was the vision experience. I mean, that's what why my son brought the medicines and why we did the ceremonies, was to do the vision experience. So the next morning, I come to out of anesthesia, and I'm feeling very positive about everything, and in some ways I'm grateful that I needed the heart surgery, because it felt like it took care of something. It felt like something was resolved simply because of the surgery. And then the surgeon, my son came, I saw him, and I'm telling him about this vision experience that I had, and this black leaving, and through the transformation to gray, and then the transformation to white. And then the surgeon comes, and I'm bold enough, I'm on morphine, who knows what, and I tell him about this experience, and I tell it to him with gratitude. I thanked him for the way that he was and what he provided for me, and I thanked him for being the kind of person that he was, that when he touched my heart, it could allow that release to occur. And then we came around to the whole issue of heart disease. Here I am back for surgery after thinking that I was doing so many really good things. And I said, you know, what were the inside of my arteries like? What did you see? And he said, whatever you're doing, continue to do. The inside of your arteries look like an athlete's, and what has happened was there was some scar tissue from the surgery that was done 3 years earlier to put in the stents, and that had blocked off a Y in the arteries that blocked off 2 channels, 2 of the arteries. But whatever you're doing is fine, and with the bypass, we've taken care of those blocks. So, feeling great, I went out after he left, I went out for a 20-minute walk, 18 hours after open heart surgery, and I come back, and the nurse is a little bit despondent. She's lost the patient to somewhere in either the hallway or the hospital. And so she checks my blood and tells me not to leave the bed anymore, and sees that I'm low on oxygen, and she puts an oxygen mask on me to give me oxygen, and leaves. And I guess because she was so upset about all of this, she leaves forgetting to turn on the oxygen bottle. So then I'm got an oxygen mask on me, I'm low on oxygen, I'm rebreathing the carbon dioxide, and I'm not even getting the fresh air in the room. So I go into the white light of the passage from this world to the other world. And so what is the white light? Is that a dream state? Is that a reality? Is something that's so universally spoken about, and it was so real to me. And then in the white light is the same guide that came 3 days before I had the heart attack, the same one, and the guide says to me, the greatest gift, it went into a little bit more detail, but basically said the greatest gift that those people that tortured you gave to you was the severity of their abuse and the extent of their abuse. So he's telling me that the worst thing that's happened to me in my life was a gift. And then he said the gift is the breadth of your wisdom and the depth of your compassion. And that was really, really a different take on viewing what had left scars of post-traumatic stress on me for decades. And after he was finished and he left, a circle of elders came, and there was one space open in the circle of elders, and the circle of elders told me that it was time for me to join the circle of elders and to share my gifts of wisdom and compassion. And then somewhere in the midst of all of that, I finally came to, and the nurse discovers that the oxygen bottle is not on and turns it on.
Oh, wow.
And for me, all of the events of that experience, my son showing up with the medicine bag, the nurse offering to place the medicine bag as part of the surgery in effect, the doctor and the entire cardiac theater being something that was from the heart, this sharing the story with the doctor, being able to actually tell him and to just have him listen and to share it with my son, going out for the walk and then not getting the oxygen. All of those things felt like they were things that should happen. They were things that there was a destiny to it. There was a meaning and a purpose to it. I mean, I could take and be very traumatized by being awake during surgery. I could be very traumatized by someone not turning on an oxygen bottle and nearly killing me. And yet, those adversities, and I see those as adversities, not traumas, those adversities gave me a deeper and a richer experience. And then the next few months, when I would be out running or doing some of the things that I would do where I just, for me, running is a very reflective time, almost like meditation. Hours of running and running alone is very, very much like meditating. And rather than ruminating on the wrong of these people, I began to, if I did think about some of the traumas that had happened to me when I was younger, I saw them more as adversities that happened, and I reflected on ways in which they gave me wisdom, ways in which they gave me compassion. And in decades of psychotherapy, which really helped in many ways I think without having the decades of psychotherapy, I think that when I had the open heart surgery, I wouldn't have been ready for this gray to leave. So there was a continuum that occurred there, and so the appreciation that the guide was speaking about was beyond the forgiveness that I learned to forgive. That it was beyond the acceptance of learning to accept that those people did what they did because of what happened to them, and that though they were wrong and evil, they had their own suffering. So it moved beyond forgiveness and beyond acceptance into this whole other realm of actual appreciation. And I began to have a very, very different light in my work. And there was a depth, there was a vibrancy, there was a deeper quality of compassion, and there was a deeper quality of knowingness in the work that I was doing with helping trauma survivors and helping people with post-traumatic stress and chronic pain. That was really an outcome of this appreciation of how that there were things that I learned, there were things that I benefited from, even though there were adversities, and that when I was working with other people that had post-traumatic stress or other people that had chronic pain, that it was important to help them see that looking at the chronic pain from a different perspective, looking at it from that you're going to get through this, looking at it that there is something that you're going to learn, there's in some way in which you are going to be deeper and wiser, there's something, and that you need to have positive thinking. And this whole different view opened me up to an area of positive psychology, and viewing that the trauma psychology of the 20th century really looked at some trauma happened to you and it left you with scars and wounds. But, trauma psychology recognized that about 20% of people didn't have those psychological scars and wounds. And trauma psychology interpreted that in a Freudian kind of way of saying, well, a person was repressed, and though it wasn't coming out in their emotions, it was going to come out in their physical body, and they were going to some way. You can't not be traumatized by an adversity. But positive psychology saw that there were people who weren't traumatized by adversities or by traumas to the degree that others, and that they had some constituents, some properties that they shared, and those properties were that you're going to get through this, that there's a lesson to learn, that there is that positive thinking. And it was certainly making sense in relationship to how I was experiencing and the extraordinary quick success, even much greater success than I had previously in helping trauma survivors or chronic pain survivors recover from their injuries. Now, no recovery occurs overnight. but those views help you move along the path in a much broader and deeper